Welcome, everyone, to University Research Week, an annual celebration honoring the remarkable, innovative, and life-saving research conducted by our faculty, staff, and students alongside their community partners. This year's theme, Back to Basics, highlights how groundbreaking discoveries can translate into practical solutions while offering valuable workshops designed to equip students and researchers with essential best practices. Thank you for joining us for our panel, Relationship-Driven Rural Research, presented by UNC Rural in collaboration with our 4 community campus partners. My name is Jada Brooks, and I am co-director of UNC Rural and a proud resident of Robeson County. UNC Rural serves our state by connecting rural communities with campus partners and resources. Our team offers programs and tools to support and strengthen these collaborative community campus partnerships. Today's panel and Q&A will focus on the crucial role of relationships in research, particularly in the context of North Carolina, which has the second largest rural population in the U.S. Currently, 78 out of 100 counties in our state are classified as rural, according to the North Carolina Rural Center's definition, which considers counties with a population density of 250 people or fewer per square mile as rural. Now let's explore how these relationships can drive impactful research and support our communities. Elizabeth Locklear is the pharmacy owner and pharmacy manager of Rocky Point Pavilion Pharmacy, located in rural southeastern North Carolina. Elizabeth has been practicing in a community pharmacy setting for over 20 years. Elizabeth has completed additional training through North Carolina Association of Pharmacists around opioid use disorder and has focused her continued education around providing harm reduction services to her community. Elizabeth's pharmacy was one of the first pharmacies in North Carolina to offer a syringe service program in a community pharmacy setting. Elizabeth continues to work with various community partners, including Delesha's team with UNC, to expand harm reduction services to rural Pender County. Next, we have Delesha Carpenter, who is a professor and executive vice chair in the Division of Pharmaceutical Outcomes and Policy at the UNC Eshelman School of Pharmacy. She's based in Asheville, North Carolina, where she directs a practice-based research network of more than 150 rural community pharmacies. Her research focuses on increasing access to pharmacy-based health services in underserved rural areas. With support from UNC Rural, Delesha's team has worked with 2 rural pharmacists, including Elizabeth Locklear, to co-develop an online training and technical assistance intervention to help rural pharmacists overcome barriers to
Buprenorphine.
buprenorphine dispensing, thank you, and reduce opioid overdose deaths in their communities. We also have Laurie Weston, who is a retired educator and community college director. She serves as a youth program specialist of the Rivers East Workforce Development Board. We're also joined by Abigail Holdsclaw, NC Impact Lead Community-Based Researcher, who leads Our State, Our Work project, serving as the point of contact between community teams and the university. She also designs program curriculum that is responsive to the needs of the local teams and supports the sustainability efforts of the 13 collaboratives following the conclusion of the university's deep engagement in December 2023. Laurie and Abigail are both UNC alumni and proud to be from rural North Carolina. Next, Elizabeth and Delesha will introduce us to their community campus partnership.
So hi, nice to see everyone here. I'm excited to talk to you about the partnership that Elizabeth and I have developed with others that's related to increasing buprenorphine access in rural communities in North Carolina. And just to give you a little bit of background, this is a screenshot from the training that we co-developed with our community partners. But most of the projects that we've done have actually started with issues that our communities have identified as important. So for the training you see here, this originally started because we heard from a rural program manager that her patients couldn't get their buprenorphine prescriptions filled. And so after hearing that, we started talking with rural pharmacists who brought up a number of issues that they were running into, such as working with their wholesalers to increase buprenorphine order sizes. And we realized, like, hey, there seems to be a major issue here. And so then with funding from the Eshelman School of Pharmacy and Research Triangle International, RTI, we launched a four-part investigation into buprenorphine access barrier in rural areas. And once we identified what those barriers were, we worked with Elizabeth and other folks to develop this training. And so they really helped us identify what the most salient issues were out of all the barriers that we identified to address in the training. So what's going to be most useful for pharmacists? We also worked with people with lived experience who helped us identify what their perspectives were, what their issues were going into pharmacies, the stigma that they encountered, how they wanted pharmacists to talk to them about these issues. And so this involving community partners at all parts of the process was key. And you can forward to the next slide if you want. They also helped us develop video scripts. And so it includes actual language that's been used in pharmacies based on issues that rural patients have encountered as they go to the pharmacy. So yeah, that's my spiel on the partnership. And then Elizabeth, I don't know if you want to talk about what your perspective's been like being on the project.
Hey, yeah. So, from a pharmacist and pharmacy owner perspective, it was actually very eye-opening because in our group, we also worked with harm reduction specialists. And, I mean, I was able to learn some of the barriers that, from the patient's perspective, because with the harm reduction specialist, they were able to inform me of some of the patient's barriers that they had on their end. So it was actually very rewarding for me because I was able to learn a whole different side of the bottleneck with the buprenorphine and basically think of ways that we could help our community to increase access to the medication.
Thank you for that insight. Next, Laurie and Abigail will introduce us to their community campus partnership.
Thanks, Jada. Hi, everyone. Nice to be with you this morning. Before we talk about our state, our work, I'm going to talk about Carolina Cross 100. And so we typically describe this as like a nesting doll. So within Carolina Cross 100, our state, our work is one of the programs. But the overarching initiative is a 5-year pan-university effort to partner with communities in each of North Carolina's 100 counties, as the name implies. And so this was charged and supported by the Chancellor's Office and coordinated by us at the NC Impact Initiative at the School of Government and led by the Carolina Engagement Council. And so this was meant to embody the university's role to respond to the needs of the state, improve the quality of life as a public university. And this was commissioned after the onset of COVID-19. And so the original mission of this initiative was to respond to challenges that have been created or exacerbated by COVID-19 through building and supporting cross-sector collaborations in communities across the state. And so with that, there was the knowledge that a lot of these issues were not new or created by COVID. And with that, many of the communities, had been saying for a while, we need and want support and additional capacity, and that they know best what issues they're facing and how to address them. And so predating me joining the NC Impact team, there was what we called a deep listening phase. Thousands of surveys were distributed across the state. There were follow-up interviews and this chance to listen and gather information from across the state from community leaders. So that as a university, we weren't deciding what program focus to have, but we were hearing directly from communities what's most helpful and responsive to their needs. So with that, the first program was Our State, Our Work, because as many of you on the call will imagine, educational disruptions and workforce disruptions were two of the most prevalent issues that came up from that deep listening phase. And so we know that everyone was deeply affected by the pandemic, but young adults were seen to kind of be impacted by both of those primary concerns. So they were more likely to have jobs in the service industry that couldn't be remote or that didn't reopen. And they were also likely to face educational disruptions. And so for those that were already facing additional barriers like transportation, childcare, perhaps re-entering their community after being incarcerated. COVID just created more chances for those folks to slip through the cracks. And so our work focused on the opportunity youth population, that's 16 to 24-year-olds that are not working and are not in school. And so I've highlighted Team 13 there in the right corner. That's the team that Miss Lori Weston was the program manager for. But this map is for the entire program. And so it's showing you that there were 13 community teams covering 37 counties. So for some teams like Miss Lori's, they covered multiple counties. And for others, like my home county of Lincoln, Team 3, there was just one county making up that entire team. And so it was an 18-month deep engagement with the state. Miss Lori still hears from me fairly often in her inbox, but it used to be like every single day during this program. And so the teams were engaging in forums at the school and virtual webinars and learning from our experts on campus, from our statewide experts that we were really happy to connect them with, and also from each other. And so I'll let Lori say more about this, but we were really excited for teams that, maybe on paper don't have a lot in common. They're in different parts of the state. One's suburban, one's rural. They serve different populations of young adults. One's led by a community college and the other's led by a faith-based organization, but they still had a lot to learn from each other, share their best practices. And I promise we had about 70 people come and engage, but most of these pictures are just of Lori here at the bottom. So you can see on the far right, her with some of her team members from Rivers East. You can see there the second from left with the orange background, them learning from our evaluation experts here at the school. And then one of my favorite photos there on the far left is Miss Lori leading a panel last November. So when this program concluded, we didn't just want all of the great learning to be concentrated with those 13 teams, but for them to have a chance to present themselves as the experts that they are and share their learning with folks across the state. So at the Friday Center, we had the state's first statewide summit on opportunity youth. And so a lot of this great learning that the teams had engaged with for 18 months, we tried to pack it all into about 6 hours for a statewide audience. Teams talked about what they had done, effective practices, but also what was really challenging. And what, even before this program, they had seen to be effective to re-engage this population. So I'm going to turn it over to Lori if you'd like to add anything about this experience or the photos here.
All I want to say is that this experience was just a great opportunity for us to learn from the experts at Carolina as well as the experts across the state. We did make great connections with other people who are in similar circumstances, and also learned a lot from people who are from very different circumstances. The best part about this is it didn't end when the 18-month sessions ended. It is still ongoing, and we have so much more to do, but we feel much more empowered, I would say, to continue the work that we started.
Thank you to all the panelists for your individual perspectives and for the insights on the collaborative work that you're doing together in your partnership. And in the next part of this session, we want to focus on learning more specifically about the relationships, which are really foundational for the work to be accomplished. So I have a couple questions that I want to pose to each of you. The first is focused on reciprocity and bi-directionality, which are core principles of community-based participatory research. How have you operationalized reciprocity in partnerships, ensuring that both academic and community knowledge and benefits are mutually shared and valued?
Well, I'll start then. When we started this project, we are funded by Workforce Innovation and Opportunity Act. So we had money We had those resources that a lot of agencies don't have. Our biggest challenge was getting to the people, those opportunity youth that needed our help, and finding them and getting them involved in our programs. So having those partnerships and that connection across the communities that we serve was absolutely crucial. And Carolina Cross 100 gave us a lot of instruction, a lot of information, a lot of resources that we were able to use to find and build those partnerships. We started out with a small group and ended up with community colleges, faith-based organizations, Department of Social Services, vocational rehabilitation, and lots of other agencies, both governmental and nonprofits, that we connected with in order to help us reach the young people in our communities. So it was very, very valuable to have that opportunity to learn how to build those coalitions. That was something that we needed that guidance from. And Abigail, she said that she stayed in contact with us quite regularly, and she was a great, great support to help us make those inroads in establishing those kinds of partnerships that benefit on both sides. It was a wonderful experience to be involved in.
Very nice of you, Miss Lori. So I'll say that from the beginning, a lot of the ways that we defined the main aspects of the project were led by community members. So from the beginning, Miss Lori and her cohort mates had this very frustrating experience. So they would ask, how are we going to measure this? How do we define community? And they kept hearing, well, it's really up to you all. And that wasn't just because we didn't have a plan or weren't sure, but really because it was important that those who were participating in the program, that its main components worked for them. So you saw before that there were some teams that were one county, multi-counties. We didn't tell folks, this is how community is defined. Whenever you apply, you have to have these type of partners. It was really up to them to say, here's what works best, and here's what we've done historically in our community to form this partnership. And so the only requirements were that they had to be cross-sector. If it was as simple as, just education or just workforce partners solving the issues, we wouldn't have needed the program, that they had to work together before. And then as we went throughout the program, the way we measured success was also determined by the feedback that folks like Miss Lori gave us. And so throughout the process, they reported on their progress in a shared measurement system, which is just a fancy Qualtrics survey, but it did give us a way to capture, what's happening locally, so that across these 13 teams, we can say, here's the progress that we're making. And so those measures weren't something that myself and my Carolina Cross 100 colleagues came up with, but across the 13 teams, they let us know what type of data they were already collecting, at what cadence and how. And we did a lot of work to make sure that the system that we created for all 13 teams was something that wasn't going to be too time consuming, and something that was going to be beneficial to them. We really appreciate that in the sustainability phase of the project, we got some funding from UNC Rural to continue to support the time and effort of the teams to collect that information. And so that's one example to me of this reciprocity of it allowed us to be accountable to our funders to talk about the impact of the project. But then we also were able to create this system for community teams so that even after the project ended, they were still able to categorize their work, talk about their impact, and even after they don't have this stamp of actively participating in a UNC project, they're able to capture their impact really well and continue to secure funding. So Lori, I don't know if you want to say a couple things about that data collection process before we turn it over to Delesha and Elizabeth.
Sure. We had a program in place that we're required to use because we are federally funded, and we were just able to disaggregate some of the information that Carolina Cross 100 was asking for from the information we were already putting in our system, which was really nice. But we also had some guidance from other agencies at Carolina that gave us some tools that we were able to use and made collecting that data a lot easier and less time consuming, and so we were able to really look at the basics that we wanted to see. Who were we reaching, how were we reaching them, and to track some things that maybe we had not tracked before, such as some of the activities, the events that we were hosting, and that kind of thing. So it gave us a broader picture of the effectiveness of our programs, and that really helped us to find where the weaknesses were as well. So we were able to use that data, not just to give to Carolina Cross 100, but also to look at from within our agency and find ways that we could make it even better.
Yes, we can talk about our project next. And I think this is a really important question because a lot of data or a lot of studies that originate out of universities tend to be extractive, right? So we go into communities, address issues that have significance, maybe public health significance, other types of significance. We get those data, we summarize them, we publish them, and then the community often never hears back from us. And so that's what needs to change. And that's why this reciprocity is so important. I can tell you from our practice-based research network, where we have rural pharmacists involved. Our pharmacists help set the agenda for the research, so they'll identify issues that are important to them, and those are the questions that we focus on for our studies. And then they participate on those studies and they provide us the data. So that's what we're getting from them. But then to give back, it's important to give back more than just an incentive to participate. We definitely want to recognize their time and the importance of their time by paying them to participate, but it goes beyond that. And so we operationalize reciprocity by offering CE trainings that they've identified they want additional training on. So we'll make sure we're giving back that way. Like, so you want to learn about point of care testing, here's a point of care testing, continuing education training for you, since you identified that as important. We also nominate our pharmacists for national awards. And so that's another way that we give back to them to recognize their participation. For this particular study on buprenorphine, which I realize I didn't identify or describe what buprenorphine is. So that's a medication for opioid use disorder. So for people with opioid use disorder. But for that one, Elizabeth has been instrumental in helping to develop the training. So we're going to involve her in manuscripts that will come out of this project and recognize her as a co-author on paper. So that's another example of the kind of reciprocity you can give in a research project.
And from my perspective, I really appreciated that we met about once a month or so, and it was condensed into 1 hour because as a business owner and pharmacist, my time is very limited. So I really appreciated that. Like our time was always considered when like scheduling and that type of stuff. That was very helpful on my part. And then just the meaningfulness of what they were, the information or the data that they were collecting from us, the relevance of it, because opioid use disorder has really increased. I mean, we're doing the best we can to curtail it, but just the treatment and the knowledge of the treatment for the disease has really come to light in the last few years. So, I mean, a lot of it was from my knowledge and me wanting to learn more and how I can help my community and how I can help other pharmacists. So for me, the biggest gain or win for myself was just my own personal knowledge, because you don't know what you don't know. So I was able to learn a lot in helping to develop this information. So that was my biggest win.
Each of you have touched on this follow-up question that I'm about to ask, but I was wondering if you could share explicit examples of how reciprocity has influenced research outcomes or methods, and if that is different than anything that you've described in your initial response.
I guess I could say using those methods has helped increase trust, in the network and increase participation in studies. So from that side, that's a benefit that we see. We also report the results back to individuals. So they participate in the study, but then oftentimes, if you participate in studies, you don't know what folks actually found. So we report that back through newsletters. And I think kind of closing that loop where it's okay, you participated in a study, here's what we found, and then they can influence where next steps happen related to that is important.
As far as we are concerned, by establishing the benefits, the partnerships that we did, we're able to make referrals to other programs. For instance, academics. With workforce development, we're involved with training and employment, but we have individuals, especially with our opportunity youth, who need additional academic training and other educational opportunities. So we're able to really establish that good partnership where we go back and forth. We're sharing referrals to the community colleges, and they're also referring students to us who need the extra help. So that's been a great benefit. We're working on a new project right now that has just started, and it's a result of this interaction with Carolina Cross 100. It's what I was saying earlier. We're still engaged in this. We're still working towards those reciprocal relationships so that we're not just trying to get individuals into our programs, but we're trying to help our individuals, our students that we're working with, get help from the other programs that they need to be a part of as well, in order to get that final goal of a sustainable career. And so that's been exciting. And one of the things that we're working with right now is trying to find ways to help maximize those referrals so that the colleges, the community colleges, we have 4 in our region, but they get to see an increase in their enrollments in the programs that are high demand jobs, but low interest or low enrollment, because frankly, a lot of our young people don't know about those jobs. And I did not say this earlier, but another part of the big picture for us was establishing relationships and partnerships with our employers in our area. So having educators, employers, and workforce development sitting at the same table was a huge benefit from this project.
Thank you to both teams for sharing how reciprocity and bidirectionality are important and serve as core elements of partnerships, and especially, highlighting how it can influence research outcomes and methods. The next question will slightly shift, and I want to ask, how do you effectively build and sustain relationships with research partners, and what evidence or best practices inform your approach?
I guess we could start off with this one, Elizabeth. So I think one of the best practices that I've identified, as we built this rural research network, is to take the time to go out and meet people in person. It really builds trust. It takes a long time, especially if you're driving all over our beautiful state, it's a long time to get out to the east and get out to the west, but making that personal contact, showing people you care enough to drive out where they're at, see their communities, understand what's important to them. I think it's just instrumental to having a successful long-term relationship. And then once you listen to them, to continue to follow up, listen, and be responsive to what they're saying to you, saying okay, I'm hearing this from you. Let's go ahead and see what we can do. What resources can we gather as the university to bring to your communities to address these issues? So I'd say that's the biggest lesson learned that I've had so far.
I want to piggyback on that because it's the same for us, even though we're not in the same field. But that persistence, that continual outreach, that continual connection, if I didn't learn anything else with Abigail's help and Carolina Cross 100, is to stick to it and not give up, because there were things that we tried that failed, and they failed for whatever reason. I will tell you, trying to motivate young people is not an easy task. And so just sticking to it and finding other ways, because of the interaction and the partnerships and the networking and not giving up, has made a huge difference in our effectiveness. And then again, to keep that going, to keep those conversations going, just because Carolina Cross 100 is over does not really, because it's not, but that 18-month period is over, and we're not meeting anymore, like we were during that training period and the learning period for us. We're still using those same strategies and those same resources to continue the conversation and to continue interacting with the people in our community who can help our young people. And so that has been a huge outcome.
Yeah, I'll definitely second Delesha's point about visiting in person, especially because in our case, we were asking folks to come to the School of Government or to the Triangle area in person 4 different times. And so, it's not fair to ask someone to drive from Cherokee or Bertie and not be willing to do the same. And it's a beautiful state. So being willing to go, and I don't think the understanding and the learning that occurs if you're not from those places can really be replicated by just talking to someone about their community. But as far as other best practices, I think mutual benefit and that co-creation of knowledge was something we took really seriously. And in thinking about what we've done since then, I was like, we've written letters of support for each other. So there have been times where Lori or other teams have been seeking federal or state funding that we've talked about all the great things they did for 18 months and why we, support a funder continuing their work. And there's been times on the university side, like when we applied to the UNC Rural grant, that I've asked Lori or other teams, can you say that we were, decent partners and help us, secure funding that we can then funnel back to you all? And continuing to help teams secure resources that they need, providing webinars. And so, if there's something that we're still hearing, it would be really helpful to learn about this, or we're encountering this issue, being able to connect them with resources. But I think beyond kind of those practices, just staying connected as people, I was really lucky to engage with such kind and generous folks throughout the program like Lori. And so celebrating things like new grandchildren or, trips or, things that aren't so great when folks go through, loss or storms recently. I mean, it was real connections and interpersonal care. And so there's real evidence-based strategies that we use, but there was also 18 months of getting to know one another and caring really deeply about one another as people that I think just makes it so easy to sustain this relationship.
Hey, and honestly, for me, again, it was all about because I've worked with Delesha on other projects, and every time she has come to me and asked about, providing information and providing my insight on something, it's always something that's relevant in my field of expertise, or like addressing concerns that we have in pharmacy, and is always seems to be things that are just coming about. So it's always interesting for me because it's I'm learning something new, and then it's always I'm getting questions I have answered, and sometimes it was always a really good as far as they would ask me a question as to my insight on something, and I would answer back with, well, this is what I do, but these are the questions I have. And then they would help we just work really well as a team to help collaborate and answer just all together to get the end result of like, what's the best practice? What's the best way to get the end result?
Thank you for your responses to those questions. One of the themes that has surfaced for me, or at least I feel like I've identified in what you've shared, is the importance of prioritizing and continually investing in relationships, and you know, how that will result in sustained partnerships and over time, and that will serve as a foundation for continued work. So thank you for that. The third question and final question focuses on rural health disparities and access issues, which are well documented in the literature. Overcoming these challenges often involves adapting research methods, addressing social determinants of health, and leveraging local knowledge. What strategies have been most effective for overcoming logistical, geographical, or trust-based challenges in rural research? And how do you ensure the sustainability of interventions in these communities?
We were not as involved in the health of the community. Like I said at the beginning, it was really workforce education, training, and employment. However, one of the things that really stands out to me is because of that persistence, because of building those relationships, our partnerships were not just with education and training agencies. We actually have built a very, very strong relationship with ECU Health, which is our largest health provider in our region. And we also established relationships with transportation agencies, with, like I said, some of the nonprofits that are in our area, so that we were allowed and we were able to go to our communities rather than trying to get them to come into our offices and that kind of thing. And that really helped to overcome the trust-based challenges. And it goes back to what we've already been talking about, establishing those relationships and really maintaining them, not just with the agencies that we're working with, but also with the community itself. One of the big things that came out of this for us was that we're very much more involved with a lot of other community boards, the housing authorities in our communities, some of the health education boards, YMCA, Boys and Girls Club, all of those community-based organizations that also serve the same populations that we do. So finding those connections allowed us to be able to provide more resources in those areas where transportation, healthcare, childcare, some of those big barriers that our young people in this area are facing, we are able to connect with other agencies to help make sure that they get that kind of help that they need, which has been a huge plus. So it goes back to continuing those relationships and building them.
Like Lori's mentioning, I think from the beginning, even though this was a program that we were talking about education and workforce, we didn't only have speakers from education and workforce. The kickoff speaker at the first forum was Honey Yang Estrada, who's the president of the Community Health Worker Association for the state. And I think that set a pretty good tone for the fact that we knew we were addressing social determinants of health. So it's not enough to just, start a workforce development program in hopes that folks get upskill. We have to talk about, if they don't have childcare, transportation, if they're, facing food insecurity, how do we help young adults address a host of characteristics and determinants so that they can achieve their personal and professional goals. Mental health was something that the teams brought up that we did our best to be responsive to, so helping connect them to resources so that young adults who are looking for a job but also want to receive services for their mental health first can do that alongside or before they engage in the job search or education process. And the necessity of this being cross-sector is something that, Lori and I have talked about. So especially in a rural, close-knit community where your systems are even more interconnected, even more overlapping, or maybe you have the same person, even working in some of these departments. If you're requiring that the community teams are not just from the library, not just from a community-based organization, you're going to be addressing more than one determinant at once. And so, you know, if we're working with Miss Lori and her colleagues at the Workforce Development Board, and we're saying, okay, we're going to upskill 20 folks and have our partnership with ECU Health. Well, that's wonderful because now 20 young adults have a sustainable, good paying job at a local hospital, but you also have 20 more health educators, health workforce folks that are going to then help the rest of the community. And so I think something that's true in this type of community-based work, but especially in rural settings, is that a rising tide lifts all boats. And so we were really excited to help with workforce and education re-engagement because it's important for the young adults, but something we talked about a lot with the program managers like Miss Lori and with the rest of the participants was that it was also going to affect the children that they may one day raise, their communities. And so it wasn't just reconnecting them to jobs.
Building upon the awesome insights that they gave, I think one of the things that, you know, we've realized over the years is that being completely honest about what participation involves helps build trust. So, you know, there can be a temptation, I think, when you're in the research space, like, I've got to hit my recruitment targets, you know, we need to enroll, you know, this many people. But instead, when you're meeting with people to say, like, if you participate in this project, this is how much time it will take, this is what's involved. So they have a full understanding and really can make an informed choice about whether they want to participate. And being upfront about that in the beginning, I think, is really important for building trust. And then one other recommendation, and Elizabeth knows this, is like to always think about implementation issues and like feasibility and acceptability, like from the get-go as you're developing projects. So you could develop the best intervention, right, that is going to totally affect outcomes. But if nobody has the bandwidth to implement it, it's not going to go anywhere. And so working with people and meeting them where they're at and saying, you know, you all have said that this is an important thing to address. What is available in the community? Like, what additional resources do you need to address this that are feasible to implement? And so just keeping that in mind from the beginning, so you're not developing something that will go away as soon as those resources are gone for the project, but something that can continue on.
And I'll definitely second that, simply because there were times where Delesha, she definitely listened to what our hurdles were and then helped us to figure out ways to overcome the hurdles. So like with just with buprenorphine, with our wholesalers, we're restricted to a certain amount because we're told the DEA limits the wholesaler. And so it was kind of cool. So they would reach out to the DEA and get a representative from the DEA to have their perspective. So just the bi-directional learning and just the fact that they really absorbed what we were saying and then gave us very meaningful information back.
Thank you. That concludes the panel part of our session, and we are going to move into the Q&A. So now we have time for questions from the audience. You can chat or use the Q&A function to ask questions. We do have one question that's directed for Lori and Elizabeth. Given your experience with this partnership, how has it changed your view on how UNC and other campuses might support your rural community?
I will just say it has, I never looked to the, I hate to say this, because I've worked for ECU, I went to Carolina. I never looked at the university from the perspective of helping us in the rural communities. And I don't mean that in an ugly or defaming way. I just never thought they were so big. And I thought that their biggest purpose was education and research. And I just never really saw them coming into the community. They were there and I didn't know. So this opened my eyes to see that there is so much more that we can do with the universities in our state that would help us. We actually, because of this project, we also got involved with Elizabeth City State University and got some representatives to come in and share information with our young people. So it's just changed my whole perspective that we need to reach out to the universities more and gain their, take advantage of your resources and your expertise and all the different components that are in a university that we don't have access to in a rural environment. So this has changed everything as far as the way I look at the universities. And I love our system. I think our state has one of the best post-secondary programs in the country, but I never saw them as being partners in our little worlds. So I think that has really, really opened my eyes considerably.
For me, I had previously done some different work with our state association, with North Carolina Pharmacists Association, but I hadn't done anything with UNC or any of the other schools. So it was kind of cool for me that, they reached out to me about, because I've put a lot of focus and emphasis on harm reduction. So it was really cool to me to see that the school was really getting into harm reduction and putting a lot of emphasis on that, because it is very important, and it's an important tool that not only practicing pharmacists need to know about, but also pharmacy students need to learn about. So I think it's really cool that that information is going to be out there for people to learn more, and it's going to have a lot broader access than what I've done in the past.
So a follow-up question is from Grayson. Can you elaborate? And I think this is directed to Delesha and Elizabeth. Can you elaborate on the work you do specifically in Pender County?
So I own a community retail pharmacy, and so we're basically, we're your mom and pop. You come in, you fill your prescriptions, you're in and out the door. Everybody knows your name. It's cheers. We're, all the things, but we put a lot of emphasis on harm reduction. So we have a syringe service program at the pharmacy. We're the only pharmacy in Pender County that has one, and we were one of the first pharmacies in the state. And that we did work with the state association through the Governor's Institute to get a grant to start up. And what we do with that is we run our syringe service program off of Coastal Horizons treatment facility in New Hanover County. And we hand out syringes along with harm reduction supplies to anyone that comes in and asks for it. So that can be someone that is currently using, that could be a family member of someone that is using, but they want them to use safely. And or it could for any reason, someone can come in and they can get harm reduction supplies. So it's all based around decreasing diseases such as HIV, Hep C, decreasing spreading of those diseases and that type of stuff. And then with the buprenorphine, I get calls daily, people saying, are you accepting new patients? Are you accepting new patients? So buprenorphine plays a key role in helping patients overcome opioid use disorder. And sadly, if they don't have access to these medications, then they are going to use a substance. So by providing access to care, we're helping to curtail the opioid use disorder or the opioid epidemic.
Yes, and to build on that, what Elizabeth has helped us do with our project is we're building a technical assistance component to the training and online training that we developed that we hope to expand out beyond Pender County into other counties, rural counties, to help rural pharmacists increase buprenorphine access.
But I do have one more from Naya, North Carolina, and this is particularly relevant for me and the work that I do. So I'm very interested in hearing your responses to this question. North Carolina has many counties and their cultures can vary greatly. Robeson County and Bertie, for example, are very different demographically, though they're both rural and have some of the same socioeconomic trends. Is there any cultural research of counties that you do before creating partnerships?
So Delesha might have more to add, but I would say from a campus side, definitely going beyond looking at what data is available about the county. Coming from a rural a rural county myself, like if you were to look up Lincoln County, you would understand a lot about our education, about the jobs available, but you wouldn't understand like how big of a deal the Apple Festival is, or how important it is that you know how to drive around the traffic circle that goes around the courthouse. Like there's just something about like being there and talking to people that's important. And so I think being able to talk to people who live there, being able to go there in person, and then like Delesha said, being honest about what a program can and can't do. And I think especially if you're really excited to partner, if you know that the university has a lot of resources to offer, it can be difficult, but being clear about what realistically can result from a partnership, how long the partnership is going to be, and then going from there. But as far as research, cultural research, I think talking to people and doing your best to understand what's important to them. Um, Looking up town Facebook groups, talking to people who know people who live there. North Carolina has 100 counties, but it feels like the longer you live here, the smaller it gets. So I'm sure somebody's cousin knows somebody who used to live somewhere, and so it's not a very rigorous research process, but that's how we kind of approach it.
Can I add to what Abigail said? I think one of the biggest challenges was making sure that we involved members of the community across the board. And so having connections, for instance, with Bertie County, one of our board members is the founder and head, and she was on the Carolina Across 100 project with us because of her connections with her community. She runs a nonprofit in Bertie County. She knows the heart of Bertie County, and she knows the needs better than I would. I don't live there. I help serve it in my role as youth specialist here, but getting the right people involved, so that you do have an understanding of the cultural needs of the community and not just a bird's eye view.
I'd second what both Abigail and Lori said, that going and meeting with people in person and hearing directly from them about what the issues are that are facing them, rather than just reading like summary statistics online, is really key. So it's not a formal process that we do, but it's just part of the relationship building process, I think, going out and doing that listening.
Thank you. We have a few minutes remaining, and we would like to highlight ways that our attendees and future attendees can get involved. I do want to thank Elizabeth, Delesha, Laurie, and Abigail for serving on today's panel, sharing their insights and valuable, I consider them pearls of wisdom. I would like to ask each of you how today's attendees or future viewers can get involved or support the work you're doing.
Check out our website. So if you're a student and want to get involved, there's a place for you. If you're a campus or a community partner, there's a place for you. We have ongoing work in different program areas, and we're happy all the time to bring in more folks into the fold. So my colleague Mary just dropped the link, and if any of that seems exciting or confusing or interesting, email me.
And I've put our Workforce Development Board website in the chat as well. You can go and see what we're doing on that page. But also, I'm happy to answer any questions if you want to reach out to me via email.
Same thing here. If anything interests you, feel free to reach out via email, and we will respond. You can also go to our Rural CP website. If you just type in Rural CP and Pharmacy, you can see that network that we've built across the Southeast.
And the best way to stay updated with other events like this and new resources for community campus partnerships is to sign up for UNC Rural's monthly email, which I'm putting a plug in for UNC Rural, which is you can locate at uncrural.unc.edu/news. So thank you again to everyone, our panelists, our attendees who joined us today. We would love to hear your feedback on this session. I appreciate it again to everyone who participated in today's panel.
Thanks, everyone. It was a pleasure.
Thank you.
Yes, thank you.
Thank you so much.
Have a great day. Enjoy the rest of your week as well.